decisions over England's new tiers map, including analysis of cases across age groups and projected pressures on NHS services. Let's talk about it in more detail. Joined by Dr. Chaand Nagpaul. He's chair of the British Medical Association. Hello to you, Doctor. Good to see you. Thanks for joining us this morning. Yeah. We're being warned ahead of hearing from Matt Hancock in the House of Commons that the tiers will be stricter, whichever one you find yourself in. Is that a good thing?
I think the most important thing, obviously, from my end, representing doctors, is we just want to make sure that we can avoid the loss of lives. More than about, I think, 3,000 people died last week of COVID. There are about over 1,600 patients fighting for their lives on ventilators as we speak. I mean, that is shockingly higher than, I think, as low as 70 we had after the first lockdown. So what we're also worried about is many hospitals are not now able to see patients with routine NHS services. I use the word routine, but these are still patients with illnesses which they're suffering from and can't be treated. So our concern is to make sure that we can bring down this infection rate so that the NHS can serve the nation, but also obviously to prevent people becoming seriously ill and dying. And what that requires is very clear and stringent measures to prevent the spread. Now that is going to, of course, mean that there are restrictions, but the better we are at adhering to those rules, the less likelihood of needing areas to be in the top tier.
What's NHS capacity looking like?
Well, at the moment, it's actually quite worrying. There are some hospitals that are seeing more patients with COVID during this second wave than during the first peak. And there are 140,000 patients waiting more than 12 months for treatment, and that compares to only 1,000 in August 2019. We have 4.5 million patients on waiting lists. 12 million patients were not seen during the first peak because the NHS wasn't able to provide outpatient appointments for them, and 2 million fewer routine operations occurred during the first peak. So what we have, and we've never had this before in the NHS coming up to winter, is this backlog of millions of patients who are effectively at the moment in limbo, waiting to know when they will be treated. I'm a GP, and patients are on a daily basis naturally asking, what came of their appointment last March that didn't happen, that was cancelled? When will they be seen? So I just think it's really important to put in perspective the pressures on the NHS. But also, when it comes to the government's restrictions, it's not just about whether restaurants close at 11 rather than 10. What we must make sure is that we have COVID secure environments. And if, for example, there were clear rules for restaurants and bars that tables are 2 meters apart, and they're certainly not where I live. I mean, the layout of tables during the peak, after the first lockdown, was very similar to before. If you make sure that you follow those rules, ventilation is important. So I think it's not just about restrictions. It is also about how you make the environment COVID secure and prevent the spread of infection, having more screen barriers between people. In that way, you can safely open some places. At the moment, I'm not seeing a consistent approach in that regard.
Yeah, I suppose I was asking you about the emergency situation in our hospitals at the moment. How does it compare to this time last year?
Right. So it's horrendous in the sense that if you look at all of the parameters we use in judging the pressure on the NHS, whether it is 4-hour targets, whether it is waiting 12 hours before you're admitted to a bed, whether you're looking at the numbers of patients waiting, or the number of cancer patients who are being treated in a defined period. In all the parameters, we are doing dreadfully at the moment, and we know that people are suffering because of the pressures, the emergency pressures on the NHS. Some hospitals with intensive care facilities are now filling up, and if things do not improve, the worrying consequence of that is that when people need critical care, they may actually need to be seen quite a distance from where they live because the local hospitals may be full. That's the level of pressure we have.
OK, Doctor, it's always a pleasure to talk to you. Thank you for joining us this morning. Thank you. Well, let's gauge the mood with